everyone. Thank you so much for joining SeniorLivingGuide.com podcast. I'm Darlene with SeniorLivingGuide.com. We are a national reach website serving seniors and their caregivers, providing them quick access to everything in senior housing and their resources in assisted living, home health care, independent living, and different resources seniors might be interested in. And today we have our guest in the podcast studio. We have Dr. Pam Tronetti and Janet Rooks. Dr. Tronetti is an osteopathic physician who specializes in geriatrics. Janet Rooks is a social worker and a dementia care specialist. They work together at the Parrish Senior Consultation Center, where they focus on the care of patients with dementia. Dr. Tronetti is the Director of Aging Services at Parrish, and Janet Rooks coordinates Parrish Senior Solutions, which provides education, resources, and support for seniors and caregivers. And we're super excited to have them in the studio today, and we're going to talk about being prepared. Can you ever really be too prepared, right? There are a lot of things we need to be prepared for as we get older. Of course, we expect the unexpected. So, ladies, welcome.
Thank you.
We're so excited to have you. So, first order of business, what are we going to chat about today?
Well, to be prepared, you come in the office and you're filling out all kinds of forms about your history. And one of the most important things is who you're going to call. On your HIPAA form, on any emergency contact, who do you need to be in contact with if we have an abnormal lab work, an abnormal chest x-ray, or if there's an emergency and you end up in the emergency room?
Yeah, and
right.
the key to that is the HIPAA form, and that stands for your Health Information Portability Accountability Act, and it was established in 1994. Now, I know that's a mouthful,
right?
But you're going to hear it quite a bit in healthcare. And on that form, every health entity is bound by that. You name who you want to receive information. We cannot talk to anybody that is not listed on that form. It is crucial that you list who we can talk to on that form.
Right.
It's your right to privacy.
Right.
Yeah, and things have changed over the years. I remember growing up, they actually listed who was in the hospital in the newspaper. And over the years, before we had HIPAA, which it's just easy to remember, hey, it's the privacy laws, we would have all family members, landlords, ministers, neighbors, people calling up saying, tell me what's going on with Mrs. So-and-so. And Janet, in the hospital, it must have been worse.
Oh, yeah. We used to have a board that when you walked onto the floor, it was written who was in the hospital and what floor they were on and who their doctor was.
Oh, my gracious.
And it was, that's all changed.
Yeah.
Trust me,
absolutely.
that's all changed.
Absolutely.
But, as a medical social worker, we are there to protect their privacy, and that's what we're going to do. There's a lot of privacy that is in the healthcare, but it's very important to list who that we can talk to. And you're going to hear it a whole lot when you do enter the health system. It's okay to have who that we can talk to in an emergency, but it's not necessarily you limit it to your favorite child,
right,
or just one person. And with our population of dementia patients, they don't always want to list someone there. They don't have any business knowing my business.
Right. So you can have multiple people on your HIPAA form?
Yeah, we actually recommend that because suppose you have a husband and wife and the husband lists his wife and they both get in a car accident.
Right.
And then the kids are calling and we say, well, we're sorry. Now, of course, there are exceptions to rules when it comes to a true emergency, but we can't talk to people who aren't on the HIPAA form, generally speaking.
Right. So if you have a HIPAA form at your doctor's office and then you have a HIPAA form at another office, do you typically really just want to have one HIPAA form and the same information on the HIPAA form? Kind of how does that work, just out of curiosity? Because I know that when you visit different offices, do they have you fill out different forms?
They do. They do. It's all their own protocols. You might want to print something up because what we need to know is what are the phone numbers? And I can't tell you how many times I've been looking at people's phone numbers, because you tend to fill those out really fast. Like,
right.
And it's like, wait, is this a 4 with an 8 written over it? Is this an 8 with a 4 written over it? I need to get in touch with this person's daughter because they're on their way to the emergency room.
Right.
Or they push 4 on their cell phone. They don't know the telephone number.
Right.
It's we all program those numbers in our cell phone. I don't know my mother's cell phone number, and she's in Tennessee. It's on my phone.
Yeah.
And the same thing with my sister. It's programmed in my phone, so I don't need to know it. I should know it, but I don't need to. It's number 4 and 5. So it's important to have those numbers available. And then you got the little card that it's all faded out, and they can't figure out the number.
Yeah, absolutely.
Yeah. And update it every year or so, because sometimes here it is, the husband puts his wife's name down and she passes away.
Right.
And unless you update it for every year, then you won't know, well, who moved, who changed their phone number,
right?
Who's estranged from the family now.
Yeah, that's all super important. So on the HIPAA form, it's super important to have a very clear phone number. I will tell you, my handwriting is atrocious, and sometimes I write my own. I can't even read my own handwriting, and I'm like going, I don't even read that, especially numbers, because they can definitely look different.
Yes, they can.
So it's really important to have something very transparent and reading it, and then maybe just keeping that one HIPAA form so every time you go to the doctor, you have everything's the same.
Exactly.
Okay. Good to know.
And this form is updated annually. So, in the event that, it's in our office, it's updated annually.
So when you visit the emergency room, one of the things that they ask you the same questions every time when you're going to the emergency room. And you go through, you go to the desk, and then you're asking the same questions over and over and over again. Why do they do that? I know that that's something that can be annoying to really anyone, but is there a rhyme or reason for that?
It's to get the correct information. Everybody has a need to know that information. The paramedic's going to ask you at home. The triage nurse is going to ask you. The billing office the intake in the billing may ask you, the business office, if you will, and the doctor's going to ask you certain information. Everybody has a need to know that information, your allergies, your medication, this sort of thing. You can print up a sheet that has that information on there, your insurance, your demographics, next of kin, your physicians, and that includes all your doctors, not just your primary care, your next of kin, your insurance, but keep it current. Also list your medications, any allergies you may have to the medications, and your insurance information. Keep it, available so that in the event 911's called and EMS shows up, you can hand them a copy of that sheet. They can use it, and the same thing with going into the emergency room. They can have it as available too. They're going to verify that information, but it's to make sure that your correct information is there available for the folks that are going to be taking care of you. Now, when you get up on the floor, they're going to ask you the same information.
Right.
But think about it. Would you rather they ask you that information and you give them the correct information than that information be passed along and something be left out?
Yeah.
But I guarantee in an emergency, you will not remember when you had a certain surgery or what the doctor's name and phone number is. So it's best to have it printed up. That way it's consistent. And like allergies to medications. Are you allergic to anything? No. And then you remember, oh, wait, I'm allergic to such and such. Well, what side effect did you have from that medication? Did it upset your stomach, or did it make you stop breathing?
Right.
And that's crucial for us to know.
Right. Even anything as simple as being allergic to
tape.
I mean, some people forget that they're allergic to that. Well, when you go in the hospital, they're definitely going to put some tape on you somewhere. And that is an irritating allergy. So good to know.
And what you were saying, Dr. Pam, is like, a rash, if it's a sensitivity, they may have to use that medication to save your life. And there may be something they can use. So if
they'll deal with the rash.
They'll deal with the rash, and they'll give you something. But it's very important to have it listed. And, I can't tell you how many times I've heard people say, oh, I can't have that.
Yeah, absolutely. So it's really a great idea for seniors, or really honestly anyone. It's not even just a senior issue, but have everything maybe just in one piece of paper or a little file or something that, especially ladies, they can actually kind of keep it in their handbags. They can fold it up, keep it in their handbags. They have everything else in there. Why not, right? That has their specifically, their medications and even their vitamins, because we've talked about vitamins and how important that that is to have listed, because it is a form of medication per se. I know we've talked, and you can maybe expand on that a little bit, but have that listed, as well as their contact information, their people they want contacted, and maybe even just tape a copy of their clip a copy of their HIPAA on there as well, so they have all that in one spot. And that's something that they can share or show in each place that they go to when they do go to the emergency room, to answer all those questions, so they're all consistent, and it may be less stressful on the patient as they're going through those different triage sections in the hospital.
And one other thing, and we've talked about that, is their advanced directives. Also have that available with that as well, so that if EMS comes, and unfortunately if that does happen, then it's all there. They can put it down in one of those plastic sleeves and have it there available.
There you
so
go.
that everything is just right there and it's up to date.
Okay. So tell me a little bit about an advanced directive. So advanced directives are a little bit... an advanced directive is something that you would have to talk about with your child or your family member.
Well, an advanced directive is a legal document. You can't sign it until you're 18.
Okay.
You have, someone under the age of 18 cannot sign an advanced directive. It is your decision, your directive. No one can sign a living will for you. You have to do it for yourself. And it's what your wishes are in the event that you have a medical condition that you do not want to be resuscitated, or your decision regarding artificial feedings.
Okay.
And then you name a surrogate to carry out the provisions of that document.
Okay.
And you list that person on that document. It has to be witnessed by 2 adults. One of them cannot be the surrogate that you've listed.
Okay.
And it does not need to be notarized.
Okay.
And you need to let the person know that you've named them. And if you name an alternate, which is always a good idea, let them know as well. Talk to your family. Let them know that you've decided to do this. Give them a copy of it. Give a copy to your doctor. Give a copy to the hospital medical records department. And then have it there. We'll go over some other documents it's important to have, and have it all there together. Also, there's the healthcare surrogate. That's a document that you're asking someone else to make healthcare decisions for you in the event that you cannot make them for yourself. Now, that would be when you, say for instance, you're in the hospital and you go in for a test, and they give you some medication, and it makes you a little bit confused, wackadoodle,
a little
or
loopy.
Yeah, a little loopy.
I love hearing all these medical terms.
I know.
Wackadoodle.
A little wackadoodly.
Yeah. I'm not a doctor. I'm not a nurse. I'm a social worker. So, but you can't make those decisions. So
Right.
your healthcare surrogate would step in and give consent for that. Now, once you clear up, the healthcare surrogate can no longer intervene in any of your healthcare decisions.
Right.
So and they're carrying out the provisions of what you would want done. They can't make decisions for themselves. It's just for you.
Right.
And so it too cannot be the person that it has to be notarized. I mean, not notarized. It's witnessed, and with 2 people.
So these sound to me like these would be really good conversations to have with the people that you are putting on these 2 documents.
Yeah, the time to make these decisions is not when you're in the emergency department.
Right.
This is something you can talk to your doctor and say, hey, I've been thinking about a living will, healthcare surrogate. Could you explain it to me? They have them online. They have them for different states. Have them available for you, and it's so crucial to say to someone you love, I'm thinking of doing this, and I want you to understand it. I want to tell you what my wishes are. Now, the flip side of that is a lot of people don't want to talk about it.
Right.
And you don't want to say, hey, mom or dad, how you doing? Just wondering if you had a living will. Kind of a tough conversation. And that's why we kind of do it in a medical setting and say, oh, by the way, many of our patients have this.
Yeah. And sometimes I think the children don't want to talk about it either, because they are like, mom and dad are going to live forever, and I don't want to talk about it because that means there's a possibility they're not going to live forever. But I still think it's clearly no one lives forever. So you have to have that conversation and just be realistic and really find out what your mom and dad or your loved ones want, so that you can fill those needs and desires, especially, I guess, on the DNR, what that looks like for them, what their desires are, so that, especially probably within a family, so what they want, so that it helps the family make the right decision and there's no issues within the family, should it come down to making that decision, and everyone's kind of on the same page, so they know what mom and dad wanted.
And I want to pull this apart a little bit and define our terms, because people get them confused. The living will, the healthcare surrogate, the power of attorney, and then the DNR, or in some states it's called POLST, which is physician orders for life-sustaining treatment. The living will, I call it the if-then.
Okay.
If I'm incapacitated and I'm terminally ill, or I'm going to be in a persistent vegetative state, if I'm in that state and 2 doctors agree, then the decision can be made to withhold or withdraw life support, not do surgery, not do other things. The thing is you could list 100 things, and I guarantee what will happen to you will be the 101st thing. So it's more general than specific. But people will say, I have a living will, therefore I won't get CPR. And that's not necessarily true.
Right.
It's, if you have a living will, you have to be in that state and have the 2 doctors agree.
Okay.
So that's your living will. You sign it with your witnesses. And you say, well, wait a minute, that's all well and good, but if I'm under the influence of medications, or if I'm very ill, I've been in an accident, who makes those decisions? That's your healthcare surrogate. And yes, don't just list one person like on the HIPAA. List one person, and then if they are unable, there's a backup.
And if I could jump right in here, never, ever, 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 ever name 2 people as a co, because then both of those people have to agree. Name an alternate, but never,
right,
Dr. Pam and Janet as the same person on that. On that list, because we'd have to agree.
Right.
And your children or whoever you name would have to agree to that. So you name an alternate.
Yeah, no, I agree with that. That, along with the fact that I feel like sometimes the first person may not be emotionally able to make the decision, and so that second person would be the one that may be able to make that decision versus the first one, because you never know how people are going to react in situations like that. So it just gives the opportunity for that.
Or the first person may have become ill, or they're out of the country.
Sure. Yeah.
All kinds of things happen.
All kinds of things happen for sure. So it's like a little bit of a safety net, a backup plan.
That's why you don't name your favorite child or the person that you name, the person that you feel like would be strong enough to make those decisions, and that you've had that heart-to-heart talk with.
Right. Right.
Because they're carrying out your provisions, not theirs.
Right.
Your provisions.
Yeah. No, I agree with that. That makes complete sense.
But it's hard, Yeah. I've stood by too many people over the years, and and it's like, okay, what did your mom? Well, she's already filled out the living will. All you're doing is saying, I want to do what she said.
Yeah.
Or what he said, and it's like, oh, okay.
Yeah. It's hard to let go, but you also have to really consider what's best for the person that you love. What really would they have wanted, and but letting go is definitely it's hard to do for when you love someone, but it sometimes has to be done. So, I'm so sorry.
Oh, I was just going to say, and people will say, well, I just won't fill one out. My kids will figure it out.
Yeah.
What happens if you don't have anybody named?
Right.
First, it's your spouse will be asked, then your children, and then it goes to your oldest siblings, and then your parents, and then a significant friend. So especially if you're getting married again, do you want your second husband that you've known for 2 years to make life and death decisions?
Right.
Or do you want a child who's known you their whole life to make that decision? If you're in a same-sex relationship and you've been in it for years and you're not married, you get gravely ill, that person is not the next person they would contact. It would be family members first. So you want to have everything in place as to who's the best person to make your decision.
Absolutely. And it can put family members at odds as well.
Yes, it can.
And you never want that. And I've seen a lot of families where it can really destroy a family when they're at odds over something like that. And you don't want to do that to your family. You want your family to come together and not let something like that tear your family apart. So I think that's really important as well. So for sure. So when there is an emergency situation and you're unconscious or you've had a stroke or something and you're in the emergency room, what document is it specifically? Is it the healthcare surrogate document that is the most important document, or is it all of them combined? Which would be the most important document to have absolutely completed if you had to pick one to know that you had to have completed for an emergency type of situation?
I would say both of them.
Yeah,
if you had both of them,
them.
the two of them, and then we have, and then to add to that is your medical power of attorney or your durable power of attorney, which talks about making healthcare decisions, that would have the authority to make decisions as far as agencies, what's going to happen after you leave the hospital, to sign contracts for medical care. For medical care.
Okay. So all of these documents are really important to really kind of button up as soon as possible. You don't want to wait on them and wait till you maybe do get ill or do need to be hospitalized or anything like that. These are things that seniors, really, honestly, anyone should really be looking into, because, none of us are guaranteed tomorrow. We may, have an accident. Anything could happen, and we want to make sure that people are looking out for our best care. So it's just something really important to kind of just look into. How would you recommend? Is this something that you would like go online or talk to an attorney, or what would you recommend a step in order to attain these?
Well, the power of attorney is a legal document. It's done in an attorney's office, and that one is notarized.
Okay.
So that would give someone else permission to jump in and make your medical decisions and financial decisions if they needed to find an assisted living facility or they needed to run your household while you were incapacitated.
Okay.
These must be portable.
Yeah.
Because, as we've often said, we've met people who say, I have a living will power of attorney. It's in my safety deposit box at the bank. And we always say the ambulance is not going to stop at the bank on their way to the hospital to pick up your power of attorney.
Exactly.
And typically, the power of attorney is also held at the attorney's office, correct? So you don't necessarily need to store your power of attorney you can as a copy, but you don't really need to.
Copies can be there.
Yeah.
But what happens if you get sick on Saturday and your lawyer's office is closed?
Yeah. You should definitely have one at home. But as a backup, in case your house burns down, you got one there too.
Absolutely. Sure.
Knock yourself out with the copies.
Yeah. You need a copy of it, and your family needs a copy as well.
For
so
sure.
that if you are not able to even express your wishes or anything like that, whoever you have named as your power of attorney, they definitely need a copy.
Yeah.
And, and right now we're going through this COVID-19 crisis. It's not people that are elderly that are just getting sick.
Yeah.
We have had younger individuals that are with life-threatening situations. They're on ventilators, and they don't have advance directives in place.
Yeah.
Their next of kin are making decisions, life-threatening, life-determining decisions. So anyone over the age of 18 should have these documents in place.
Yeah.
A living will does not mean do not treat. It just means that in the event that these certain provisions take place, there will be a conversation with the doctor and the healthcare surrogate, you know, and it rarely does it ever get to where that it ends up in the courts.
Right.
It
right.
may, you know,
Yeah.
it can,
You
but
definitely want to
rarely-
avoid that.
Yeah, we don't want it to get there.
Yeah. All right. On that note, we're going to take a quick break, and then we will be back with Janet and Dr. Tronetti.
At Parrish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parrishhealthcare.com/orthoaware. Parrish Healthcare, where the art of healing comes to life.
Hey, Mom, how's the retirement home search coming?
Oh my gosh, I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.
At Parrish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parrish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parrish Healthcare, where the art of healing comes to life. Visit parrishhealthcare.com/healthaware for a free health risk assessment.
Welcome back, everyone. We are still in the studio with Dr. Pam and Janet from Parrish Healthcare. So we're going to talk a little bit more about some of these documents that we need to have completed when we're going to see physicians and for emergency purposes. One of the things that I was curious about, so if you have dementia or early onset dementia, so how do you kind of work around some of these documents? Because clearly you want to know some of the documents that you're signing and some of the decisions that you're making.
Mm-hmm. Well, if someone comes in and we're making an early diagnosis of mild dementia, part of our team is you need to see your lawyer, you need to see your financial advisor.
Okay.
And they can put things into place, living wills and healthcare surrogates, and name somebody powers of attorney. Eventually, as the dementia progresses, you reach a point where that person doesn't have the capacity to make those kind of difficult decisions.
Right.
So hopefully something is in place before that.
Okay.
Yeah, but unfortunately, we do see those individuals that they have some paranoia with the dementia, and they do not want to give up that responsibility. No, I'm not going to have anybody paying my bills. No one's going to take power of attorney. I am not going to do anything. You are not going to do that. I can take care of myself. I can pay my own bills, and they will not, under any circumstance, sign anything. And it's unfortunate. The family will really struggle in times like this.
So when that happens and you do have a dementia patient that doesn't have any documents that's been completed, what is the solution to that? Do you Is that something that you have any advice on?
Well, it all depends. If if they're in the hospital, then there's provisions through the hospital for assumption of proxy.
Okay.
There's a form that they will sign, and we'll notify the risk manager and at the hospital, and that we have someone that they would sign assumption of proxy.
Okay.
So they assume that role of being their proxy.
Okay.
Because they don't have those provisions in place.
Okay.
If they need to have access to the bank account, then that's something they'd work with the bank. Dr. Pam will actually fill out a document or a letter that states they do not have the ability to make decisions for themselves due to a medical condition, and that suffice most of the time.
Okay.
There's a lot it's a lot of responsibility for the family. It's like herding sheep back in there after they ran out. So
Right.
we really encourage to get it done ahead of time.
Right. Does that usually typically include bringing in an attorney? Does it get more in the legal side of it when it's not done prior to?
Not necessarily.
Okay.
Because sometimes it's obvious that here's this person who's been taking care of their mom or dad for a number of years. They have acted on their behalf.
Okay.
They have their best interest in mind. And then they can jump in and take over things because they have to. But
Right.
it's much, much easier for them if
If it's already. Yeah, absolutely. So when this occurs, does this declare a person incompetent? Is that what this kind of means?
That's what a lot of people think.
Okay.
But only a judge can declare someone incompetent.
Okay.
What physicians do is we measure decisional capacity. So this person might have the capacity to say, what they want to wear and what they want to eat, but do they have the capacity to understand that we want to do open heart surgery? Could they sign a consent? And the answer is probably no. So we need someone else to assume that responsibility to
Right.
do that. So what Janet was talking about is often we have to write a letter of decisional capacity saying this person has dementia, and now it is up to their next of kin or power of attorney to take over that role and that responsibility.
Okay.
Which, of course, you're assuming that the power of attorney is going to act in that person's best interest. If they
Right.
start taking advantage or mismanaging funds, then there's other recourses.
Right. That makes complete sense. So that's really interesting. So tell me a little bit about when those decisions are being made, the declaring someone potentially incompetent. How does it affect, any of these other documents? So the documents are not something you would go forward with. That's something that becomes more of a legal issue, or.
Well, there's a couple different questions in that. And sometimes if the person, like Janet said, is fighting and they don't want your help and they're not taking care of themselves, the family will go before a judge. It's a guardianship hearing.
Okay.
Now, it's different in every state, but it's always costly.
Yeah.
Because it always ends up in court. You have to have expert witnesses. You have to have a
Right.
hearing. And then the judge will say, okay, I am naming this person as the guardian, which is essentially an elevated power of attorney. They get to make all of the decisions for this person.
So you really, really kind of want to avoid that, because that can be very costly. Yeah.
And there's different levels of guardianship. They can be guardian of the person. They can be guardian of their finances, or they can be guardian of both.
Right.
And to help with that. And there's agencies that do that. They're private guardians. But, so and they have to report back to the courts annually.
Right.
So, we do try to avoid that. We'll go through, we'll look at everything and try, because we're all about the patient.
Right.
And I'm an advocate for the family and for the patient, but the patients come first. And we're going to do everything we can. And, the attorneys are out there and to try to help as well. So it's a lot of talk.
It is. And,
Yeah,
and
really
you
is.
need somebody who knows what they're doing. A dementia care specialist will help you. There's senior specialists. Because what you kind of had buried in that question is families will come to us and say, okay, my mom needs bathed and dressed and fed. Can I fill out a living will for her? No, you can't. Can I sign as her power of attorney? No, you can't. Those are things that the person had to do.
Right. So it's harder for the family to get the things that they really want and desire for the simple healthcare things for their loved one, if they're going through more of the longer route to get those things done.
It is. And, it's just harder because when you get to a critical situation, family members say, I don't want to make the decision to, they'll say, pull the plug, withdraw, withdraw all of this machinery and ventilators and life support.
Right.
But if they said, you know what, I am doing this because my mom or dad said that's what they wanted or didn't want, that's a whole different mindset.
Sure, absolutely. Absolutely. So there's something that's called 5 wishes. So explain that a little bit to me, the 5 wishes.
It is a fabulous document, and
Okay.
it encompasses the living will, the healthcare surrogate, but it also gets into end of life. It gives me goosebumps.
It gives you goosebumps.
God bumps when I talk about it. It talks about what you would like, your comfort.
Okay.
What type of music would you like played? Do you want music played? Would you want lotion rubbed on your arms and your hands? At the end of life. Who do you want to visit you? What things have you left unsaid? And it's your final word. You get in the last word.
Yeah.
And it's used a lot with hospice agencies.
Okay.
But it's also a document that you can actually say, well, yeah, I'd like a funeral, I'd like a memorial service, I would like a full, or I'd like a party. I want a party, a celebration of my life with rock and roll music, or whatever. And when you fill out the document, it's something that a talking point. You can talk to your family. I got this document. I want to sit here and talk about what I want done at the end.
Okay.
I want all of y'all. I want my kids to get along. And you can write that on there, or. Billy was not nice to me in school, so, the heck with you. That kind of stuff. And, here I am, 90 years old, I'm dying, and you were mean to me. You broke up with me in high school, and the heck with you. I never forgave you. And it's just really interesting, but that document is there. You can.
Where do you find that document?
Hospice has it.
Okay.
We have them in our office. Doctors' offices have them, but it is
it's online.
And
it's valid. I want to say 44
states
of the 60
Okay.
the 50 states.
So
Sorry about that.
40 states. 40 states. I'm a little behind.
And it does include a healthcare surrogate and a living will.
That is super interesting. That is not something I have ever heard. So that is completely new information for me. I like new information.
We brought one with us. We could show it to all of our podcast listeners.
So
just hold it up.
Let me see if I can get this. I think that this, if I can
there you go.
Get it really good in the camera. And I'll actually include a link at some point where
lovely.
we can find it. It's multiple pages, so it's not just one sheet where you just fill out a few little questions.
It takes time.
Yeah,
It's thoughtful.
So it's very thoughtful. My wish for how I want people to treat me, my wish for how comfortable I want to be. I'm just going through a few of these. My wish for what I want my loved ones to know, that just makes me want to cry, in all honesty. And there's, I wish to be forgiven for the times I've hurt my family. There's all kinds of ideas in here and different thought-provoking sentences and different things. I think this is absolutely wonderful to be able to fill this out. I think that a lot of people that are going through end of life, especially people that have, life-threatening diseases, that know that their time is, imminent or even years from now or what have you. I think this is a really important document to fill out and talk about with their family long before it comes to that point. First of all, I think it will probably bring families closer together because I think, people that are ill, it's stressful. It's so stressful on families because, you don't want to accept that your loved one is that ill, whether they have dementia, cancer, heart, anything.
Yeah, lung disease, oxygen, kidney disease.
Yeah, it's hard on families. It's just one of those things, and to have these kind of conversations, I think it can only bring a family closer together. And then it just really can fill in some of those gaps at the end.
This is a good document that, as you mentioned, with a family, but it's a non-threatening. So my caregivers, I've given them to them, and we'll give them several copies so that they can sit down and say, "Hey, I got this document. I'm filling out one. My husband's filling out one. Let's look over this, Mom. Let's look over this, Dad."
Right.
So it's not, here you've got this such and such diagnosis. I want to have you fill this out. So it's a non-threatening. It's it's something that you can't. It's better to do over a period of time. Let's have a Danish and a cup of coffee and let's read over this. I heard about this. I heard about this 5 wishes document, and even the states that it's not valid in, they will recognize it and honor some of the wishes, the advance directives.
A lot of times they have another state document that has to be attached, but this is a launching point.
It really is.
So one of the things that I kind of see with this, it has to be witnessed. It can be witnessed, notarized. So it really is a document.
It doesn't have to be notarized in Florida.
Okay. And then you can also cut out the fact that it has like a card inside of it, and you can put it in your wallet so that people will know that you actually have this document in case anyone goes through your wallet, which everyone does at some point. But one thing that I kind of see in this, if you're not if you don't write in journals, this is almost like a mini journal, kind of. But it's, specific bullet pointed, so you kind of get all your thoughts and wishes out. It kind of gives you a guide if you're not a journaler, if you're not a journaler, is that a word? But that's what I really like about it. I think it's really great for families, and it's probably something that even after you pass, your family's going to keep this. It's going to be kind of a keepsake,
right,
per se. So I think that this is really cool. So I just love the fact that this is something that is actually available. So I'm so glad you guys brought this. I had no idea. So we'll definitely include this link, and I actually want to kind of explore that a little bit more at some point. So to kind of cap things off, so who would typically, one of the things, we talked a little bit about DNR. So who would typically want a DNR? Would everyone, do you think typically most people should get a DNR, or you think that's something that is specifically to just a select few of people?
Well, let's start with a good definition. DNR stands for Do Not Resuscitate. Now, folks will come to the office and they'll say, "Oh, I have one. I did that at my lawyer's office when I did my power of attorney." No, you didn't, because it's always done in a medical office. It is signed by the patient or their representative or both. It's signed by a physician. It has to be bright yellow.
Canary yellow.
Canary yellow.
Canary yellow.
Okay.
In Florida to be honored.
Okay.
What it says is, under no circumstances do I want CPR or a ventilator.
Okay.
Now, we always say do not resuscitate does not mean do not care, because people will say, well, what if I call 911? They'll just stand there. No. If you're sitting there choking on a piece of meat, they're going to do the Heimlich maneuver. If you have chest pain, they're going to give you oxygen. They're going to give you nitroglycerin. They'll give you the aspirin. They'll take you to the hospital. But if the heart stops, do not bring that person back. If you have a living will, you can wave it in front of the EMS crew all day long. Your living will says, if I'm in this condition, and if two doctors agree. So they would have to do CPR until they got to the hospital setting. most people will keep, who have a DNR, they have severe diseases, and they say, you know what, I don't want to be brought back if I pass away so that I can suffer more.
Right.
And those are the folks, most of our patients 85 and up will say, you know what, I've had enough. I want this DNR. Or I've had a loved one go through this. I've watched them on the ventilator. I don't want that to happen to me. So it gets signed. We make copies in canary yellow. Most people keep it at home on the side of the fridge, on the side of the cupboard. You can, you know, put it face down, but that way 911, if you call it, they'll come, they'll see that.
Okay.
And they'll know where the lines are drawn.
Right. I appreciate you explaining that, because I know some people do have the fear that they just won't try to save me, but that's not the reality of it. It's much deeper than that. So, and clarifying that. So, well, on that note, I think that we are at our time, but I do want to end on a positive note on the 5 wishes. So, is there like a link to this? So actually, I'm going to give one that's a local link. It's hospiceofstfrancis.com. Do they have the link on this website, or do you have another link, or maybe I'll just share that somewhere else?
I know 5 Wishes has its own.
5 Wishes has its own link. Okay, so I just saw this on this document. So,
but you know, we're all just passing through.
Okay.
So
yeah. So definitely look up that link so you can see this document. It's really very interesting if you're still interested in looking that up. And until then, check us out for our next podcast, which will be coming up shortly. Thank you, everyone. Have a great day. Thank you. Thank you, Janet and Dr. Pam.
Great to be here.